Urban Health Research Initiative is essentially a network of studies looking at primarily homelessness and addiction among marginalized populations. We've been tracking infectious disease incidents in terms of HIV and hepatitis C in the downtown east side, and looking at things in the built environment like homelessness and other issues affecting vulnerable populations that help protect people from HIV and also can result in health-related harms that have people coming into St. Paul's. We were responsible for the evaluation of the Insight Supervised Injecting Facility, which was associated with about a 70% reduction in fatal overdose deaths. We've been involved in evaluating the Stop HIV/AIDS pilot project in the downtown east side, where we've seen a greater than 90% reduction in new HIV cases in the downtown east side. And really something that has been a persistent challenge is untreated drug and alcohol addiction, and that's where our focus has really come in recent years, and with support to the St. Paul's Hospital Foundation from Goldcorp, we've been able to start the St. Paul's Hospital Goldcorp Fellowship in Addiction Medicine, which will fill a huge leadership void and a clinical void that's existed for a long time. And St. Paul's will be a leader in this, and that we have established Western Canada's first interdisciplinary training program for physicians in addiction medicine.
Injection drug users had been neglected consistently over the years by many programs, and in fact many people out there felt that they were an intractable problem, and really through the methodic and diligent efforts that Evan and the Urban Health Research Initiative ultimately brought to bear on this problem, we were able to demonstrate not only that we could actually address the issue, but we could address it and actually generate data to support policy changes that have now been embraced nationally and internationally. So that at the end of the day, we are known internationally as one of the few jurisdictions that has had a dramatic impact on decreasing morbidity, mortality, and HIV transmission, specifically among injection drug users, something that was thought not to be possible.
What we, I think, have done is brought an extremely high standard to research with papers, in the New England Journal of Medicine and other journals like that have had huge international impact. But I think what makes our group somewhat unique is that there's a huge culture of not just publishing research in a journal and putting it up on your shelf, but ensuring that that research then has an impact for people who have volunteered their time to participate in the research, or for people who are vulnerable to the questions you're asking in your research. And so, to use as an example, because of the research that was produced in evaluating Insight, that contributed to a unanimous federal Supreme Court decision to keep that program open.
I think it's fair to say that very few people synthesize the PHC's vision when it comes to making it a reality. Every day's driving force for Evan is about compassion, excellence, social justice, and ultimately innovating to improve the lives of people that need our services most.
I am obviously honored and pleased to accept this recognition on behalf of the large group of my colleagues, graduate students and residents, other trainees and staff who all contribute to this enterprise, and thank those who nominated me.